Everyone, welcome you all to my new YouTube channel, Your Physio Tutor. So today we are going to discuss about Piriformis syndrome. We will discuss about the piriformis muscle. So here you can see the piriformis muscle. It is a flat, oblique and pyramidal shaped muscle which lies just below the gluteus medius muscle. The piriformis muscle originates from the anterior sacrum and it is inserted into the greater trochanter of the femur. The nerve supply is ventral rami of S1 S2 and the actions are it externally rotates the femur. It also stabilizes the sacroiliac joint and abducts the femur when the hip joint is flexed. Now the sciatic nerve, which is the largest nerve of our body, also emerges below the piriformis muscle, and entrapment of the sciatic nerve can lead to sciatica. So now we'll discuss about the piriformis syndrome. So, it is a condition in which the piriformis muscle compresses the sciatic nerve, causing symptoms of sciatica into the lower extremity. Piriformis syndrome occurs due to the entrapment of the sciatic nerve at the level of ischial tuberosity. There are multiple factors that may contribute to the piriformis syndrome. The patients often report pain in the gluteal region, which is characterized as shooting, burning, or hacking down into the back of the leg. Now I'll discuss about the etiology. So the causes of piriformis syndrome includes trauma to the hip or buttock area, piriformis muscle hypertrophy, which is increase in the size and mass of the muscle, and sitting for the prolonged period of time, and anatomic anomalies such as bipartite piriformis muscle and sciatic nerve course or branching variation with respect to the piriformis muscle. Now we will discuss about the anatomical variations of the piriformis muscle in relationship with the sciatic nerve. So here we can see in the first images. So first one is the typical course of the sciatic nerve, which is exiting the pelvis through the greater sciatic foramen and below the piriformis muscle. The second image is showing the nerve splitting into one branch passing through the piriformis. The third image is showing a split sciatic nerve wrapping around the piriformis. The fourth one is showing the entire sciatic nerve passing through the belly of the piriformis muscle. And the fifth one is showing the sciatic nerve exiting the pelvis superiorly to the piriformis. We'll talk about the epidemiology. So, the piriformis syndrome may be responsible for 0.3 to 6% of all causes of lower back pain or sciatica. With an estimated amount of new cases of low back pain and sciatica at 40 million annually, the increases of piriformis syndrome would be roughly around 24 million per year. In the majority of the cases, piriformis syndrome occurs in the middle-aged patients with a reported ratio of male and female 1 is to 6. So females are more prone to get this disease. We'll discuss about the signs and symptoms. So the typical signs and symptoms of piriformis syndromes are chronic pain into the buttock and hip area, pain when getting out of the bed, inability to sit for prolonged time, pain in the buttock that is worsened by hip movements. Patient will often present with symptoms of sciatica, and it can often be difficult to differentiate the origin of the radicular pain. The patient may also complain of buttock pain, and typically, palpation may reveal mild to moderate tenderness around the sciatic notch. For the diagnosis part, there are several tests that we can perform to confirm the piriformis syndrome. So, the first one will be the Freiberg sign. So, in the sign, the patient will be in supine position, and the therapist forcefully internally rotate the patient's extended thigh. And if it causes pain in the deep gluteal region, then this test is considered positive for piriformis syndrome. The second test, which is pace test, it is mainly resistance abduction and external rotation of the thigh. So the patient in seated position with his feet together and therapist placing the hands on the outside of the knees and asking the patient to push the knees outside against the resistance. If it produces or aggravates pain in the buttock, then it is considered positive for piriformis syndrome. Discuss about the third test, which is the BT test. So patient will be in the sideline position on the unaffected side with the hips and knees flexed, and abducting the thigh if it produces deep buttock pain, then it is considered positive for piriformis syndrome. Fourth test is fair test, which is flexion, adduction, and internal rotation of the affected side. If it produces posterolateral or back side of the buttock pain, then it is considered positive for piriformis syndrome. PT management, non-operative modalities such as ultrasound ice pack, then moist heat, gait training exercises, stretching of the piriformis external rotator and IT band, strengthening exercises, and soft tissue manipulations can be done. Some exercises that a patient can perform. First one will be the piriformis stretch. Second one is the standing hamstring stretch. Third one is the hip abduction. Fourth one is the partial curl. Fifth one is the prone hip extension. And sixth one is the quadruped arm or leg rise.